Joining us today is Dr. Krista Bruni. She is an optometrist in Sault Ste. Marie practicing since 2010. She is a co-owner of Sioux Optometry Clinic in the Churchill Plaza. Welcome, Dr. Bruni. Thank you for joining us today.
Thank you for having me.
So can you tell us a little bit about yourself and how you became interested in optometry?
So I am born and raised in Sault Ste. Marie. As far as getting interested into optometry, it was honestly when I realized that I wasn't cut out to be a veterinarian. So after 20 something years of thinking I was going to be a vet, I took a sharp turn and ended up pursuing optometry. Looking back, this was the best decision I could have ever made. Optometry has given me the opportunity to help people in so many ways, from giving a child their first pair of glasses to helping patients manage diseases like macular degeneration and glaucoma. Each day is different, always brings something new. And optometry is really a profession where you never stop learning. Many of my patients, I've been practicing for 10 years now, um, really feel like family a lot of the times when they come in, and they are comfortable enough not only to tell me what's going on with their eyes, but things that might be happening outside their lives that can sometimes affect their vision that they may not realize at the time. I'm also fortunate to work in a large clinic with several other optometrists who share my love of optometry as well.
Sounds like a really interesting journey that you've been on, and I see actually a lot of parallels between our stories. I initially was going to become a medical doctor, and then I suffered from a number of different health concerns that were kind of snowballing out of control, and I wasn't able to fully get the help and support that I needed. I had incredible doctors on my team, but then I knew that there was something more I needed in terms of being able to heal underlying causes. And I found that in naturopathic medicine. And it was just an amazing addition to these incredible doctors I already had working with me. So I also had a bit of a pivot in my career, which was really interesting. And I love the way that you describe your practice and like your sense of, family with your patients, because you really come to know people while working in the healthcare field, right?
Yeah, absolutely. And it's amazing even seeing patients from when they're 8 years old to now they're 18, or you get to see them grow, and you get to see everybody at different stages in their lives in 1 to 2 year intervals.
Very true. And it's incredible, especially in, talking about children, to see how much growth there is in, in that amount of time. And it's just a beautiful thing and really nice aspect of being able to practice in this field and in Sault Ste. Marie, where we're all really connected as a community.
Yeah, absolutely.
So what are some common conditions that affect the eye that women might experience?
So there are kind of a few top diseases that come to mind, and women tend to be affected more than men because a lot of these diseases are age related, and women tend to live a little bit longer than men. Glaucoma, macular degeneration, and cataracts are the most common sight-threatening diseases that tend to affect people as they age. Um, I really can't stress enough how important regular eye exams are. Checking, a lot of people come here and think we're just checking the prescription for their glasses, but while that's an important part of the exam, there's a lot more that we do and we look at. When I start by checking the prescription using the phoropter, which is the 1 or 2 machine that everyone loves, I can usually tell right away if there's something else going on than just needing a new prescription. Some patients will feel like 1 or 2 are really terrible choices, and I promise I'm not trying to trick you. But that usually instantly tells me that there's something going on at the back of the eye that's affecting the vision that sometimes glasses can't help. It's really countless the number of times I've had patients come in and say, I need new glasses, my vision's blurry, and it ends up being early cataracts or early macular degeneration or something along those lines. Another thing that my colleague, Dr. Chartrand, and I have found over the past several years is the number of patients coming in complaining of dry eye. and the number of women coming in complaining about dry eye. I would say for the first several years out of school, these patients would come in and we would recommend artificial tears twice a day and send you on your way and see you back in a year. Now there's so much more research into dry eye and especially dry eye in women's health that we actually have pivoted to offering dry eye exams here. And that really allows us to take the time to assess your environment, your underlying health, and your symptoms a little bit more in depth. It's so prevalent in women and so multifactorial that we felt it needed a separate place in our exam intake and our patients being able to offer them something extra.
Thank you for those insights. And I want to just come back to a key point that you mentioned early on in that response, which is how important it is to have screening exams because this can help with detecting issues early. This applies across all different healthcare professions, including optometry. So if you're screening for concerns early, then there's often treatment options that can be offered that perhaps might not be available to you if something has progressed further.
Absolutely.
hmm And coming back to what you said about dry eye, I want to go into a little bit more. What are some of the underlying causes that may be a risk factor for developing dry eye in women?
So dry eye many times is caused by either you're not making enough tears or the tears that you are making just aren't really doing a good job, or it's a combination of both. Age, being a woman, being on certain medications, antihistamines, blood pressure medications, having an underlying inflammatory condition such as rheumatoid arthritis, diabetes, or even thyroid disease can really increase your risk of experiencing dry eye. Environment and the amount of screen time uh, you have in your life are huge, have a huge impact in how your eyes may feel during the day. When we're looking at causes for dry eye, we really need to have an idea of all these factors, plus take a good look at the anatomy of the eye and your tear glands to make sure there's no inflammation or blockages. My dry eye patient base tends to be women over the age of 40 with underlying inflammatory conditions. So the first question I ask if someone's complaining about dry eyes or scratchy eyes or irritated eyes is if there's any history of arthritis. And if there is, I know right away that patient is going to require a little bit more care and probably a little bit more detail into their treatment plan for managing their symptoms.
I could totally see how those different factors could potentially contribute to dry eye. And I think it's important for women to understand that so they could see that perhaps if they're experiencing irritation or scratchy eyes or that kind of thing, that maybe they can tune into that this is what may be happening and that it should be looked at by an optometrist and assessed.
Yeah.
hmm And you had also mentioned, a number of different conditions. So first I want to ask, what are key times in a woman's life when eye problems can emerge?
So I have a lot of patients come in when they're pregnant and they notice some vision fluctuations and also during menopause. So those hormonal fluctuations can really cause some changes with the vision. Sometimes it'll be intermittent blur throughout the day. Sometimes it may be blurriness associated with headaches. And sometimes what I've noticed, especially during menopause, is just auras, just little flickers of light that women tend to experience. They don't really last longer than 20 minutes. They're kind of off-putting. And then once they're through that time, they never experience them again.
I think it's so interesting to hear about your clinical experience in working with women that, these are potential times. I don't think that it's necessarily on the mind of women to be watching out for eye issues that could be associated with hormonal changes. This might be some really new information for women to be hearing today.
Yeah, and a lot of time, it's always important to come in if you're experiencing any symptoms, just in case it's something a little bit more serious.
Yeah, very true. It's always important to be eliminating those more serious potential causes of the symptoms that you may be experiencing. And, from my understanding, more often than not, it is the, more minor symptoms. But of course, you want to catch those more serious concerns as they arise, not later.
Exactly.
hmm And so you had mentioned as well some other common conditions in women. So I want to explore these a little bit further. What are signs and symptoms that a woman may have if she has glaucoma?
So glaucoma is the number one disease that I'll diagnose with a patient having absolutely no symptoms. It slowly takes away your peripheral vision, so you really don't notice if any symptoms until it's taken a lot of your visual field, a lot of your peripheral vision. So once that happens, once you're in a later stage of the disease, there's really nothing we can do to bring back your vision, and we're kind of rushing to save what vision you have left. The good news is that glaucoma is extremely slowly to progress in most cases. So regular visits with the optometrist can kind of put you in a risk category, low risk, average risk, or you know what, we're going to watch you a little bit closer, have you come in maybe for some additional tests, or just have you come in a little bit more regularly than you have been to make sure nothing's changing.
I think it's really great to adjust depending on the risk category that a woman might fall into given the symptoms. What are some of the potential treatment options that you can offer in your scope of practice relative to a diagnosis of glaucoma?
So with glaucoma, typically the goal of treatment is to reduce the pressure inside the eye, the intraocular pressure, and that helps preserve the health of the optic nerve. That's kind of what glaucoma affects. So there's some really great medications. It's typically 1 to 2 drops a day in each eye, and that keeps the pressure down and really reduces your risk of progression. You can also be managed with an ophthalmologist as well for glaucoma.
I think it's really great to know the potential treatment options because sometimes, just hearing the information about glaucoma can maybe be overwhelming or feel scary. But when you recognize that there is treatment options and that they could be something that are simple as eye drops, then that might alleviate some of the fear in acknowledging that there's an issue there or maybe pursuing treatment options and getting screened.
Absolutely. And I think my job is to just reassure my patients about what we can do. And if it's not the best outcome, if it's not the news they were wanting to hear, just really outline the steps, outline what can be done, and how we're here to support them.
Yeah, very true. And, you had also mentioned macular degeneration. What is happening inside the eye when a woman has this diagnosis?
So with macular degeneration, as opposed to glaucoma, it's the central vision that's affected. So the part of the eye that sees 20/20, that really crisp, clear vision. Um, the macula actually starts to show some deposits. And there are two types of macular degeneration. There's dry and wet. Dry macular degeneration will make everything a little bit fuzzy. You might see a little bit of distortion if you're looking at something that has a straight line or words on the page. There's no treatment for dry macular degeneration at this time, but we'll usually see you a little bit more often to make sure it's not progressing. Um, we recommend certain vitamins that can help reduce the speed at which the dry macular degeneration may progress. Wet macular degeneration tends to progress quickly and affect the vision pretty substantially. In patients who present with that, we're usually referring to ophthalmology that day.
Mhm.
Um, I have a quick picture.
Yes, please show us.
So this is an OCT. It takes a picture of the layers of the back of the eye, including the macula. So when I hold this up, that little divot that you see right in the middle here, that's the macula. And this is a healthy eye. So there's that strip of white, there's actually 10 layers of tissue in there. So that's a normal eye. And then in wet macular degeneration, the anatomy is totally changed. And you can see that there's fluid here and here as well. And that nice contour of the macula is no longer there. So in a patient with wet macular degeneration like this, the vision's really affected.
Thank you for sharing those images, Dr. Bruni. I think, a picture can really say 1,000 words, and it's really interesting to see how dramatic the differences that are there, particularly when you're zooming in on an image of the eye.
Yeah, it's amazing. And technology has really allowed us to image and pinpoint the cause of a patient's decreased vision, and allow us to triage better.
Yeah, makes sense. And you had also mentioned referral to an ophthalmologist or management with an ophthalmologist. I'm curious to understand a little bit more. What is your working professional relationship when it comes to, between ophthalmology and optometry? Where's the bridge there?
I think in Sault Ste. Marie, we're extremely lucky to have a really great professional relationship with the ophthalmologist. If we feel a patient needs to be seen, they see them. And the communication between us and them is irreplaceable. It really, from what I hear from colleagues in other jurisdictions or parts of the province, it's not always a great relationship, but I can definitely say here in the Sioux it is.
I'm so glad to hear that. I think, there's nothing more important than having a healthcare team. And that is part of the thread that sort of weaves together this entire series is how can we all be working together to really support the patients that need our help, and who could potentially be a great addition to a patient's healthcare team, and that we all have different areas of focus in our practice, different scopes of practice, different treatment options we can offer. So I think it's a very important consideration. I'm so glad that you have really positive things to say about your working relationship with the ophthalmologist.
Yeah, it goes a long way. It goes a long way in just triaging the patient, getting them the care they need. And we're a northern community. Sometimes treatment can't be done up here, so it's really important. Everyone's on the same page to where is the best place for this patient to be treated.
Very true. It makes for very expedient treatment, efficient treatment, and to get the best possible outcome given whatever scenario shows up.
Exactly.
So I want to shift gears a little bit and hear your take on this question. What is the relationship between stress and eye health?
Stress is one of those things that we can pretty much peg any weird symptom on when a patient presents with blurry vision, fuzzy vision, things just don't seem right. A big one is my eyelid is twitching. That the number one cause of that is stress, along with lack of sleep and increased caffeine. So typically all three of those go together. If I have a patient who's experiencing fluctuating vision and everything else kind of checks out, it's not their prescription, the back of the eye is really nice and healthy. And I have them come back in a month or 6 weeks after and their symptoms are resolved, it always goes back to, this was happening and it must have really affected me as far as stress, loss of a loved one, various reasons people come in and they may not, especially women, um, show it to everyone else, but it just comes out in different ways. And the eyes are definitely one of those ways.
Yeah, very true. It's an interesting connection that you make, and that is a symptom that I have noticed show up in my patients that are experiencing, stress or struggle, challenge, and change in their lives. So I think it's important to draw that connection, to have an understanding that maybe this isn't a new eye condition per se, but it's a symptom showing up in the eye that is actually related to stress itself, or some type of circumstance that might be inducing stress.
Exactly. And a lot of times like I said, we double check there's nothing else going on. We might make a few recommendations, and sometimes just with that reassurance and time,
hmm
better.
Very true. Very true. So what are some common obstacles that women encounter who are struggling with eye conditions?
Women, time for when they present. Women in general are really concerned about their eye health. especially when they come in here. They're really great at taking notes, but sometimes they kind of let symptoms slide or um, not really make the connection if something's a big deal or not. Um, Once they're in the office, once we are talking about their health and their symptoms, they're definitely a little more willing to make changes in their lifestyle or follow a certain treatment plan. Um, we're just, as women, we're so focused on making sure everyone else is okay that sometimes we forget to act on our own symptoms quickly.
Very true. And that is actually a really common thread with that question about obstacles again throughout this entire series that has come up, how women are, they're very used to putting others first, and then they don't so often take as much care of themselves, or at least they're not prioritizing their own care, whether it's healthcare or self-care, whatever it is. So that is definitely something that's really common to come up. That being said, I think if we can identify that obstacle and be quite aware that that can happen, then we can find ways to overcome that and make a different choice as a result.
Absolutely. And even sometimes finances may be a hindrance to getting the care that women need. In Ontario, if you have glaucoma or macular degeneration, diabetes, or a few other underlying diseases, you're actually covered through OHIP to come in for regular exams. Um, some of the dry eye treatments can sometimes cost a little bit of money, but we always start simple. And I find a lot of patients, even just a warm compress before bed is all that they need. So we always make sure to take the whole picture into account before making recommendations and doing what's best for the patient.
I appreciate your holistic graduated approach to maybe test out some lower level interventions first and then explore other options if you need to. I think that's a really great way to approach care. And I think it's important for women to know as well that with certain conditions that there may be coverage there through OHIP, because again, there might be more of a willingness to seek care if there's an understanding that this could be covered, that can help with that potential financial burden that someone's anticipating.
Yeah, um, absolutely. And I still find it's surprising that women aren't aware of that.
I really thank you for sharing that point. I think it's really important. I also wanted to hear a little bit about what current health practices you might recommend for promoting better eye health.
I always tell my patients, best practice for your eyes, don't smoke. If you're a smoker, you have two really great reasons to quit and eat your vegetables. So time and time again, study after study, a diet rich in leafy green vegetables, think spinach and kale, and fish or an omega-3 supplement are the best way to keep your eyes healthy and especially prevent macular degeneration. UV protection for your eyes. So just like um, sunscreen is really important from, I almost said suntan lotion. Sunscreen is really important for your skin. Sunglasses are really important for your eyes. And that also helps prevent things like cataracts and macular degeneration. For kids, spending more time outside and less time on devices and less time kind of here with the phones and the tablets has absolutely been shown to decrease the risk of needing glasses to see things far away. So basically, eat your vegetables and get outside.
Yeah, I think those are great points. And also considering that, there's mounting research with so many different reasons to eat your vegetables. If you're not already doing that, here are even more reasons yet to do that.
Yeah, some patients laugh when I say it, and you can have your dessert. Just have a salad before.
There you go. So I'm wondering too, in your experience, with all that you've shared and just in your clinical experience too, how does eye health reflect on overall health?
I really do feel the eyes are the window to the soul. And diseases like diabetes and even cancer, if it shows up in the eye, a lot of times it's somewhere else in the body. So the body does a really great job of protecting the eyes from all these disease processes. But when we see something in the eye, we know it's worse in the body. And there's been countless times where I've had patients come in and then straight to their family doctor, straight to the ER for blood work to test for diabetes.
Mhm. Well, yeah, it's incredible what you can see in the eye. And as a naturopathic doctor, part of my scope of practice is, performing screening eye exams. And I think it's just incredible what you can see inside the eye. And it's one of my favorite exams. It's just, I don't know, suddenly there's this surface and then you go behind it and you can see so much there. It's amazing what can show up in the eye.
Yeah, and I think it's here with some of the technology we have too, and we can show patients, and it never gets old to see someone's reaction to see what the back of their eye looks like.
It's fascinating, absolutely. And then I'm wondering from you because resilience is a topic that's important to women's wellness, and it's a topic that's near and dear to my heart. What does becoming more resilient mean to you, and how does it apply to the women that you treat?
Um, for resilience, I think women just have this innate talent to roll with the punches and focus on the well-being of others. The strength we give to those around us gives us just even more resilience, more ability to pretty much deal with anything that comes our way. Um, and I think it's just important to turn that vision and that resilience sometimes inwards towards ourselves so we can be stronger.
That was such a beautiful response. I want to thank you so much, Dr. Bruni, for your time today, for sharing your story, for sharing your clinical experience and such a wealth of knowledge about eye health. I think that this will really have a significant benefit for women on their health and wellness.
Thank you so much for having me, and I hope everyone learned something new today.
No doubt. Thank you again.
Thanks.